Hello everyone. In this video, we are going to learn yet another very important therapeutic skill that can be utilized by physiotherapy students and young practitioners to assess and treat cervical pain and stiffness. So let's get started. Now, to quickly assess and treat cervical pain and stiffness, such patients are asked by physiotherapist to lie down in the supine lying position, and the therapist is going to sit at the head end of the treatment couch. So making the patient lie down in the supine lying position helps in the offloading of the cervical spine and also helps in the relaxation of the muscles that are required to hold the cervical spine against gravity. Now in this position, it will become easier for the therapist to assess the cervical motion segments. So let's first understand how to assess the cervical spine mobility by a demonstration on the skeleton model. So what the therapist is going to do is, therapist is going to first locate the C2 spinous process, and the C2 spinous process is going to be hooked by the distal phalanx of the middle finger of the therapist, and the therapist is going to pull the spinous process to one side in order to rotate the C2 vertebra, and the therapist is going to look for two things. One is the tenderness, that is, when the therapist applies this force, does the spine feels tender? And the second thing is the end feel or the yielding of the spinous process. Now whenever there is a stiffness present, the pull or the force of the therapist is not sufficient to yield or move the spinous process, and the therapist also gets complaint from the patient that this maneuver feels tender or painful, and this signifies that this particular motion segment or the vertebra is stiff. Please do note that when we apply pressure to the C2 spinous process from left to right, the vertebra is intended to be rotated towards the left side. And if this feels tender or painful and the spinous process or the vertebra does not move, then this indicates that there is a stiffness for the left cervical rotation. Now the therapist is going to move on with the examination and then next going to pull or apply force from the left to right side over the C3 spinous process, and again will take note of the tenderness and the end feel, and this examination is going to progress up to the C5 C6 level, and the same thing is going to be done from the other side as well using the left hand. So this time we are pushing the C2 spinous process from right to left to check for the right rotational stiffness. So this is how the technique looks like on the patient. The therapist is sitting at the head end and then goes for palpating the suboccipital region, the suboccipital fossa, and then goes and palpates the prominent C2 spinous process, and then hooks the C2 spinous process with the distal phalanx of the middle finger. And now I am pushing the C2 spinous process from left to right side, and I am looking for two things. I am going to look for the yielding of the spinous process, and also I am going to ask the patient whether this particular movement or application of force is unpleasant, tender or painful. And then I am going to progress my examination from superior to inferior direction, always trying to apply force to the spinous process from left to right to check for the left rotational stiffness. And the same thing is going to be done now with the left hand, distal phalanx of the middle finger, to check for the right rotational stiffness. Now after the therapist has made note of the segments which are tender and stiff, the treatment is going to be applied. So to treat the cervical pain and stiffness, the therapist is going to utilize the same handholds that were used to assess the cervical pain and stiffness. So the therapist is again going to utilize the distal phalanx of the middle finger, which is going to be hooked over the desired level of the spinous process. So let's say in our examination finding, we found out that the C2 spinous process was stiff and tender when was pushed from left to right side. This indicates that the C2 vertebra has a left rotational mobility restriction. So to treat this motion restriction, the therapist is again going to apply a force to the C2 spinous process from left to right side, and at the same time the other hand of the therapist is going to be utilized to rotate the cervical spine in the desired direction, that is towards the restriction. And now this mobilization is going to be done by the therapist. Therapist pushes the C2 spinous process and at the same time tries to rotate the cervical spine towards the left. Now the therapist can also opt for combining this mobilization with the muscle energy technique. So let's say, for example, I push the C2 spinous process from left to right, rotate the cervical spine towards the left, and I find that there is a motion restriction and we have a barrier beyond which it is painful for the patient to move the cervical spine. So I can now ask the patient to just breathe in and with 25% of the force push into my hand and return back to the neutral position. So breathe in and push into my hand with 25% of the force. And as the patient breathes out, he needs to relax, and the therapist is going to take the patient to the newer range of left cervical rotation. And please do note that this pressure over the C2 spinous process is maintained throughout from left to right. Now this same process of mobilization is next supposed to be carried out at each of the spinal level which was found to be stiff and tender. So this is one way in which we can treat the segments in an isolated manner. As well, we can use more than one finger to treat group of vertebrae. So like for example, I can just place my middle finger as well as the index and the ring finger over the group of spinous process, and then I can mobilize them to one side, that is from left to right, and at the same time I can perform the left cervical rotation. So we can start by treating first locally, and then we can move on with the global mobilization of the cervical spine. So this was one of the most common technique that I often use to treat my patients of cervical pain and stiffness. I sincerely hope that the information shared in this video is going to be helpful for you all. Do keep motivating us with your comments and feedback. See you all in our next video. Till then, keep learning, keep sharing, and stay connected.